think we are live. All right. Welcome to the live stream, everyone. Hopefully the audio is working. I'm just going to do my audio checks just to make sure everything is good right now. Let's see. I have the live stream set up over here to the side just to double check. Looks good. Okay. I think we're going to get started. All right, so welcome to the live stream. This is going to be the first of 95 live streams every single day for the next 95 days. Since this is the first live stream, I just wanted to do a quick introduction of what's going on here. And my name is Brian. For those of you who don't know me, I am a informatics pharmacist, and I plan on taking the AMIA's AHIC certification exam that was recently announced like last month. And as a way of studying for it, I'll be doing daily live streams and also sharing it with the rest of the larger community. Hopefully it'll be beneficial. So let's see. If you're not familiar with the AMIA AHIC exam, there are 5 different domains. You can probably see it on the screen right now. It's over here to the left. Foundational knowledge, enhancing decision making, health information systems, such and such. So 5 different domains, and then a total of 144 knowledge and skills that they are saying is going to be on the exam. And so given the large amount of content, as you can see I have here, I'm planning on pacing myself in terms of how I study for this. Up until the testing window opens, which I calculated over here. The testing window actually opens September 13th, 2021. So between today and that day, there are 98 days. There's 144 sections. And to appropriately accommodate all that time without overstudying, I'm going to do about 1.5 sections every single day for the next 95 days. It's a little shorter than 98 because I'm going to be doing 1.5 sections. So I have that sectioned out over here. But yeah, so that's what I plan to do. And then I'll actually finish a little early on some September 10th. And that's about it. So I'm about to jump right in, but I just want to note also that these are working sessions. So I'm not necessarily teaching. This is just kind of my own knowledge, but hopefully it'll be beneficial because you can kind of see the content, perhaps what to study for. And then if people are watching this on the live stream, it'll be great if you want to add some comments, maybe certain things that I should look into while putting together this outline and study guide in itself. But I will also try and narrate what I'm doing. So maybe some folks who are just listening and not watching the video can just listen on and use this somewhat as a study guide eventually. 95 different live streams if you guys plan to take an exam. But eventually, if I do end up passing the exam, which cross my fingers, I hope I do, I'll likely curate this content with the rest of the team into something much more digestible, like a course or something. So you're not having to listen to me ramble on for these 95 to whatever amount of hours that I spend on this. Okay, so I'm just gonna jump in. Every single day, what I'm gonna plan to do for each of these live streams is 1, introduce the topics, which will also be in the title of the live stream itself. Number 2, I'm just gonna begin constructing the general outline of what I think the topics are. If you kind of look at these things here, like number 4, for example, international efforts to advance health informatics practice. I have no idea what they're trying to test on. I'm going to try to formulate an outline of what I think they're going to test on and then start filling in the details and gaps with different sources I find. And everything is going to be live streamed so you can kind of see my process here. That's what I mean by construct the general outline, fill in the details. And what's going to be nice is every website I go to, I'm going to cite my references, which on here, I'm using Zotero, which is awesome. Very easy. I can just go ahead. I need to actually open Zotero. I can add all these references in here. I can actually show you. So let me put in a citation. Let me log in. Where is it? What's really nice about it is it will add a, let me see, I can just show certification. It'll add the citing of stuff, cite for me, and then at the very bottom, it will populate the references. So hopefully by the end of the 95 live stream, I will have a nicely referenced study guide for folks. Okay, so that's kind of what we're doing here. Let's see, what was I gonna do? Let's start with what we're talking about today, which again is going to be on the live stream. So for today and tomorrow, I'm going to be doing the discipline of health informatics. This includes the definitions, history, domains, and professional organizations, just as examples. And then some of the fundamental informatics concepts, models, and theories. That's the 2 topics for today. So I actually started this a couple weeks ago, and it's quite a lot in trying to look up the definitions of these, but this is what I have so far. Domain 1, foundational knowledge. I just took the examples, which they're probably gonna have more than this, but I'll just use the examples here that they have. Definition, history, domains, and professional organizations. And I already started working on this, so I'm probably gonna be done soon. Let me just reference some of these again. So for the definition, this is an AMIA certification. So much of the resources I'm pulling is from AMIA. And I do know that AMIA has a white paper that talk about this. I believe that's where I pulled the, oh, here it is. Yeah. They have a white paper that they wrote, I think it was in 2012. Yep, 2012. Where they talked a lot about what exactly is biomedical informatics. So I'm gonna take this, let me just go ahead and cite it so I have it. Certification study guide, yep. There it is, so it's the AMIA board white paper. So let me go back here. I can probably take this out so I'm not confused. This, so yeah, I pulled the definition from this white paper that they have. Let me cite this in here. AMIA definition, white paper. There we go. Very nice. I believe, yeah, is the core scientific discipline. Yeah, this was also from there as well, so I could probably get rid of this reference. White paper. Yep. Yeah, and the basic premise here is that biomedical informatics, I'll just go ahead and read the definition, is the interdisciplinary field that studies and pursues the effective use of biomedical data, information, and knowledge for scientific inquiry, problem-solving, decision-making, driven by the efforts to improve human health. And it's a pretty broad encompassing field, and you can kind of see it here that clinical informatics is just a piece of it. And within the clinical informatics area or domain, there's subfields like medical, nursing, and dental, which in this case would also include pharmacy. So biomedical informatics incorporates other things like public health informatics, more of the research side of things, and stuff like that. So it's the broader term to use. Okay, so we're gonna look at the history. I think that paper also talks about the history, which would be really good. I remember reading this paper a while back. Let me see. Definition, yeah, so history. So what I'm gonna do is just pretty much copy and paste this into here. It's a good term. Let's see, it's core discipline. I don't think we care about that. Yeah, history, and probably go back here. The committee was tasked. So the term biomedical informatics began to emerge in the 1990s as the Human Genome Project and the expanding investigation of issues in data analysis for basic biology, led to a greater awareness that the methods and processes of what had been known as medical informatics were broadly applicable across all biomedicine. I feel like there was another definition that was more historic. This definitely dates back beyond 1990. Let me see. Oh, this is the certification about AMIA news. Maybe in here? No. Was developed a formal depth between the resulting paper. Okay, whatever. I'll just go ahead and copy this. This is good to know, anyways. Go ahead and paste this. It's doing a ton of plagiarism. But it doesn't matter, because this is my own study guide. So we'll do that. I'm just kind of curious if there is something else. Google is always your friend. So, oops, that's not what I'm trying to do. I'm trying to Google history of biomedical informatics. Online degrees. Golden era. Origin. Wow, 1986. Back when medical informatics is a new knowledge domain of computer and information science. Very interesting. Yeah, let's get something a little bit more recent. Evolution of informatics. This is interesting. Got a book. The History of Medical Informatics in the United States, ebook. By Dr. Marion Ball. No, maybe this one. Moore and colleagues. High performing. I want to do a little bit more of a history though. Let me just go ahead and search for history of biomedical informatics. There's like a that's not what I'm looking for. AMIA years. Might be spending a little too much time on this. Inception through AMIA history. What is this about? No, that doesn't look interesting. I remember them talking about the history of informatics somewhere. Maybe we'll just look at this blog. The brief history. This might do. Let's go ahead and just use this nice little summary. This is a brief history. So I feel it's managed large amounts of data. First, it's just like general good knowledge to know. And I might eventually, go back and comb through and put some more detailed information in there, but this is fine. So let's put this under brief history by, I think this was like UIC. Informatics AHIC. Let's go ahead and put that citation, which was brief history. Go. Cool. All right. Let me make this like a little broader. I'll make this a little bigger in this situation. All right, domains. So the different domains of informatics. I usually like to go with AMIA for all these kind of questions, and you can kind of see it here. They don't call it domains, they call it informatics areas. And so there are 5, which I'm sure there's other groups that split it into multiple other quote-unquote domains, but I thought this is pretty nice. This is how I usually think about it too. So let me actually cite this site as it. This is the science of informatics. Science of informatics. There we go. So let's get definitions for each one of these. So translational informatics. Let's go back here. Translational bioinformatics. Nice. You got nice little. Oops, there's no definition for me. If you guys ever need to learn how to plagiarize, this is what I am doing right now. There we go. So it is the development of storage, analytic, and interpretive methods to optimize the transformation of increasingly voluminous biomedical data and genomic data into proactive, predictive, preventive, and participatory health. Translational bioinformatics includes research on the development of novel techniques for the integration of biological and clinical data, the evolution of clinical informatics methodology to encompass biological observations. End product of translational bioinformatics is newly found knowledge from these integrative efforts that can be disseminated to a variety of stakeholders, including biomedical scientists, clinicians, and patients. It's a pretty straightforward definition, right? It's like it's almost like research to bedside. Or is this what this more is like? Clinical research informatics involves the use of informatics in the discovery and management of new knowledge relating to health and disease. It includes management of information related to clinical trials and also involves informatics related to secondary research of clinical data. Clinical research informatics and translational bioinformatics are the primary domains related to informatics activities to support translational research. Interesting. It's interesting that they get their own area, you know what I mean? Let me go ahead and paste that. Do this. Okay. Clinical informatics. Next definition. This is probably what most of us are familiar with. It's like what we do when we're taking care of patients or directly in the hospital. Application of informatics and information technology to deliver healthcare services. It is also referred to as applied clinical informatics and operational informatics. You know, part of informatics is also learning all these like strange terms. That's a big piece of it. AMIA considers informatics when used for healthcare delivery to be essentially the same regardless of the healthcare professional group involved, whether dentist, pharmacist, physician, nurse, or other health professional. Clinical informatics is concerned with information use in healthcare by clinicians. Clinical informatics includes a wide range of topics ranging from clinical decision support to visual images, radiological, pathological, dermatological, ophthalmological, from clinical documentation to provider order entry systems, and from system design to system implementation and adoption issues. Perfect. Let's go go ahead and paste that. Clinical informatics. Consumer health informatics. Move back here. Consumer health. All right. Consumer health informatics is the field devoted to informatics from multiple consumer or patient views. These include patient-focused informatics, health literacy, and consumer education. The focus is on information structures and processes that empower consumers to manage their own health. For example, health information literacy, consumer-friendly language, personal health records, and internet-based strategies and resources. The shift in this view of informatics analyzes consumers' need for information, studies and implement methods for making information accessible to consumers, and models and integrates consumers' preferences into health information systems. Consumer informatics stands at the crossroads of other disciplines such as nursing informatics, public health, health promotion, health education, library science, and communication science. So like any type of patient-facing technology, like wherever you have patient-facing stuff, that's consumer health informatics. I think patient health records is a good example there. Public health informatics. Let's take over this. The application of informatics in areas of public health, including surveillance, prevention, preparedness, and health promotion. Public health informatics and the related population informatics work on information technology issues from the perspective of groups of individuals. Public health is extremely broad and can even touch on the environment, work, and living places, and more. Generally, AMIA focuses on these aspects of public health that enable the development and use of interoperable information systems for public health functions, such as biosurveillance, outbreak management, electronic laboratory reporting, and prevention. I think the best example of this right now is like the COVID pandemic. You know, the ability to collect data at a national, if not international level, in terms of like our testing capabilities, vaccinations, and all of that kind of stuff. That's a nice grouping for that. Cool. That's domains. And the last one is professional organizations. I think for this one, I didn't have any sources per se. I just kind of Googled health informatics organizations and I just started assembling them. But they're pretty straightforward. The big ones: AMIA, AHIMA, HIMSS, AMIA, HL7, and these other ones I just kind of like pulled from random places. But I think the first couple ones are probably the most important. I think that's it for this section. Yeah, that's it for this section. Just very basic general stuff that everyone should be aware of. Fundamental informatics concepts, models, and theories. So I have no idea what they are going to talk about. Like, what do you want to know? Informatics concepts. So what I usually like to start when I don't know anything about a particular topic, I just literally just Google. Let's see. And then we just pull together some different things. So here is fundamental informatics concepts, conceptual models in health informatics research. This does not look like what I'm looking for. Let's just do fundamental informatics concepts. It's interesting. University of Edinburgh. Scope of informatics concepts. No. Teaching fundamental concepts of informatics. Zurich. No, it's so vague. It's really difficult to like know what they kind of want you to know. Basic concepts. And you know, how does it differ from like the part 1 of stuff? Concepts and theories. Concepts, models, and theories. Let's see if AMIA has anything on this. Or let me go to Pubmed to see if I can pull anything. Informatics concepts. Let's do like in the last like 10 years. Informatics nurse for next generation. Context sensitive health informatics. Oh, this is probably like a good example, like these kind of things. This is probably like a concept, like how distributed cognition theory posits that our cognition are so tightly coupled to the environment that cognition extends into the environment. Beyond the skin and skull, it uses cognitive concepts to describe information processing across external representations. Okay, so these are the type of theories that we're probably looking for. This is interesting. So let's try to look for more concepts. Like this is like theory. It's probably things like that will impact how you design technology. So let's see, theories. Let's do theories. Let's actually break it down into those things. Concepts, models, and theories. In this case, we do distributed cognition. Understanding complex socio-technical informatics. Go ahead and save this. This is distributed. Cognition. Probably just pull the listing I'm getting. I'm not sure if they really test you on these kind of things, but it, you know, maybe applications of these kind of theories may be tested on. Fundamental informatics concepts. Let me see if there's something else. Clinical practice, you know, the group of concepts. Go back here again. Concepts. So or the expecting that big data could change the field of medicine is inconsistent. You know, maybe we can group that under concepts. Medical data is not yet why we need. So when is this article from? 2019. I feel like we might just make some of this stuff up here. So maybe we can group this into like, or say like, talk about databases. What's like, maybe managing data. Oh no, maybe we do like, yeah. I think these would be concepts that, when I think of informatics concepts, like managing data, you know, like databases, big data, probably keep one, concepts, like project management, ontologies, like these, what are like user experience and design, things like that. Models, like what kind of models are you talking about? Or maybe it's, I'm not sure. Oh, let me go back there. So this one references big data, so like maybe a big level artificial intelligence, the ones that they had, machine learning, deep learning. Yeah. What we are, what we publish. I know they had a paper on AMIA Competencies, so maybe I'll talk more about it there. Aha, foundational domains. 3 domains. So the discipline of health informatics exists at the confluence of 3 major domains: health information science, and technology, and social and behavioral science. Graduate students in this discipline are expected to have working knowledge of these 3 domains, as these domains define and affect the practice of health informatics. Where 2 domains of knowledge intermingle, each affects the other. The graduate student is expected to demonstrate the knowledge, skills, and attitudes that exist in these commingled domains. Okay. Knowledge. Yeah, this looks about right. Information science and technology refers to the key concepts, methods, and tools for creating, acquiring, storing, representing, accessing, merging, organizing, processing, transferring, analyzing, reporting, visualizing data, information, and knowledge. It also includes the methods and tools for protection of data. Yes, this is probably like the stuff we're looking for. Included are understanding how information is used and the ability to assess the information needs of users. Familiarity is required with basic computer science terminology, including and concepts including terms and concepts related to information systems and computer programming, information retrieval, ontologies, business intelligence, analytics, and user interface design. Ha! I guessed some of this. Okay, let's see. At the time of graduation. Yeah, I think this is like kind of the stuff we're looking for. Basic social, behavioral, psychological, and management theories, models, as well as the legal and regulatory framework that seek to describe human actions and interactions. includes concepts from the fields such as sociology, economics, anthropology, political science, law, psychology, management, and cognitive sciences. It is concerned with the application of social, behavioral, psychological, and management theories, methods, and models to the design, implementation, and evaluation of health information behaviors at the level of individual, social group, organizations, and society which are influenced by laws and regulations. The purpose is to contribute to decreasing health-damaging behaviors and improving health-promoting behaviors and psychosocial well-being through health informatics perspectives. Cool. Do we have more definitions here? Human factors and socio-technical systems refers to the interactions between human behaviors and information technologies. People and organizations are the ultimate users of health information technologies. This domain draws on the social, behavioral, cognitive, economic, human factors, engineering, management, and social and system sciences in considering the needs, workflows, and practices of individuals and organizations, contexts, and systems. Okay. F5. How is this like grouped? Oh, it talks about all this. Health, information technology, social science, social aspects, health, information science. I think these are like the main concepts. We probably just take the concepts from here. Professionalism. We all gotta learn about professionalism. Leadership. Yeah, I might just use this as the primary framework, which is the AMIA Health Informatics Core Competencies for CAHIM. And there, maybe I'll look for something else. Core competencies for applied. This is only for health informatics, though. Quality assessment for applied health informatics. Let's see, the foundational domains. They use the CAHIM competencies. Let's see if they have anything that they show in here. Oh yeah, they reference the same thing. These domains define the field. Building competency. Yeah, I think I'm probably gonna pull from this. So I'll go ahead and cite both of these. This is the AMIA board white paper, AMIA 2017 core competencies. I wonder if this was just like a more friendly definition that was used, or the final thing of it. Cite both. So we are going to use, we don't need this. Is this 10? Yeah, these are 10 what are they calling it? 10 domains? Yeah, the foundational domains. And each of these domains can break down pretty nicely too. So maybe I'll remove my stuff and then maybe concepts, models, and theories. I don't know if I want to keep that kind of format anymore, so I'm just gonna steal this. So we're gonna do right here. Like each of them has its own concepts, models, and theories. To foundational domains, we are going to cite AMIA Informatics. What is this one called? Final AMIA. Of course it doesn't have that. No. Yeah, this is close enough. Let's use this. F1, health, F2. Informational science and technology, F3. So these are like general concepts, models, and theories. F3 is like social and behavioral science. F4 is information science and technology. F5 is human factors and socio systems. F6 is social and behavioral aspects of health. 7 social behavioral and information and technology applied to health. But there's gonna be just so much overlap in this. F8. Professionalism, F9. Professional practice. 10 is leadership. Okay. Let's see. Like this. So I think for this piece, things like key concepts, methods, and tools. Creating, acquiring, storing, representing, accessing, merging, organizing, processing, transferring, analyzing, reporting, and visualizing data. That'd be like one part of it. Like, how do you manipulate data, right? Methods. There's also methods and tools for protection of data. From unauthorized access. What information is used. The ability to assess the information used by users. Basic computer science terminology and concepts. And computer programming. Social and behavioral science. contribute to decreasing health damaging behaviors and improving health, promoting behaviors and psychosocial well-being through health informatics perspectives. You know, it's all about how we think that users are going to use the tools that we design. I think it's going to be the intersection that makes more of a tangible thing to study here. Health information science and technology. The array of health information science and technology methods, tools, integration, using, governing, and learning for the biomedical spectrum informatics. System design and development addresses standards. Oh, that is interesting. So things that be drawn on from here. This pertains to like actually manipulating data as it pertains to health. And so competencies here is systems design, so it's like development, health standards. You're gonna need to know integration, interoperability, protection of information, human factors. Here it is. Interaction between human behaviors and interaction between human behaviors, which include physical, social, cognitive, and psychological, and information technologies. People and organizations. You know what? I probably should just copy it from these sections. That'd probably be the easiest instead of like putting. Yeah, that's what I'm gonna do. So I'm just gonna copy it. Might as well. Okay. Oops. F4. Paste without formatting. There you go. I think like at a high level, this will probably give you a good idea of what informatics as a whole, what would make you successful in informatics, and you know, having a good understanding of all these things right here. F3. How long have we been live streaming? Oh, almost an hour. Maybe we're live streaming for like another hour and we will be good. F3. This is F3, right? Paste that formatting. Okay. Oops, one more. Cool. F2. So F2 was information science and technology. That's why it's so hard to get into informatics. It includes all these things that you just gotta know. F2, here we go. Paste without formatting. Okay. There we go. Health. Where's your health definition? Here you go. Paste with that for me. It feels nice to like not worry about plagiarizing, because this is my study guide. Don't gotta paraphrase or anything. Straight up copy and paste. Social and behavioral aspects of health, which was what? F6. So what is this? Taken by individuals, groups of individuals, or an organization to manage the health of an individual population, entails social determinants and patient-generated data, analysis of problems arising from health or disease, the implication of these problems on daily activities, the practical solutions to managing these problems. Patient behavior that may be affected by genotypes and phenotypes, health literacy, informed decision-making, patient engagement, and patient activation are examples of issues in this domain. Other common topics in this domain, depending on the program focus, may include health behavior paradigms, such as health and healthcare service management, substance abuse, utilization of healthcare services, characteristics of nutrition, exercise, physical activity habits, organizational networks analysis, precision medicine, and individualized care. There's just so much content, man. I don't even know how you would like write a question about one of these. Maybe just this section. Cool. F7. Is this like a combination of everything here? F7. Here you go. Social, behavioral, and information science and technology applied to health refers to the integration of social, business, human behaviors, behavioral, and information sciences and technology on the design, implementation, and evaluation of health informatics solutions. The application of health technologies in clinical and or business processes can impact individual and community health outcomes at numerous levels, from biological systems to healthcare and organizational protocols to social systems and public health. I don't know how helpful this kind of stuff is. It's just like joins everything together, not saying much. But I'm gonna proceed with just copying this in. Probably not gonna copy those. This is probably fine. Is there other major concepts? So I think this is all good, right? Then like maybe you want to dive a little deeper. So within these things, I can within each foundational domain, I can pull out different concepts and models. I think what I'm gonna do is I'm gonna merge these things, concepts, models, and theories, and come up with a couple that perhaps are somewhat promising. The distributed cognition probably is not that big, but that's fine. I think within this, like if you take into the context of these foundational domains, so some of the things I would think about is like tools and methods to manipulate data. You know, I think concept is like basic, you know, this concepts. So it's like tools and methods to manipulate data. I could do like project management, change management and control. Probably be other things. You probably need to know like human factors engineering would probably be a concept. That's not what I'm trying to do. There we go. Probably need to know things like concepts and like protection of data, privacy and security would be another one probably. Analyzing data. How do you like... These aren't concepts. I think change management control is more like concepts. Ontologies is probably more concept. Data ontology. We'll probably group this under like knowledge engineering and data ontologies. Probably something like that. Concepts. Project management, these are almost like skills in a way. I wouldn't say they're like concepts, right? Human factors engineering is definitely one. Going back to like the other thing, user experience design would be another one. Concepts, so human factors engineering is already that other one. I think this might be it for now. Are we at an hour yet? No. I kind of want this to end already. Maybe we can just like look, tools and methods to manipulate data. So I'm thinking like in this case, like databases, big data, or actually big data can probably get its own. You can probably like look up a article about big data. Oh, you probably do like concepts, artificial intelligence would probably be something that falls under that, or not really. Nope. This is interesting enough. Healthcare, resurvey the current status, be applied. Both discussion. That's not really what I want to take a look at though. Maybe we're just save this for this part for next time. This is there you go. I should probably not spend this much time on this. Maybe do something more simple, like just a basic definition of what these concepts are. Human factors engineering. Yeah. What is this one about? And patient safety. Frank Lloyd Wright. When was this published? There's something else. No, I'm going a little overboard right now. This is probably fine. It's like a good... It's common to analyze adverse events by determining why the people involved made the wrong moves or decisions. In the US, UK, and Australia, hospitals commonly use root cause analysis teams to address these issues. RCA teams are supposed to look beyond blaming people into systemic vulnerabilities. It is unfortunate that some only look for data to support their misconception that they need to create a list of the errors and procedural violations. In fact, errors and violations are only the jumping off points to a different kind of journey, not the end game. Human factors engineering is a discipline that uses methods and concepts to understand and build systems that are more efficient, comfortable, and safe. The concepts and tools of HFE can therefore help RCA teams to analyze more fully events and close calls that involve, for example, medical devices, software, and work areas. Instead of thinking why the people involved are so odd, we can use HFE to see why their decisions and actions make sense. The more we think of why we do or think the same way if we were in their situation, the more likely we are to arrive at productive and long-lasting interventions and redesigns. It is easy to say that we need more systems thinking, but hard to do. HFE provides tools and concepts to help with a difficult job, and HFE analysis of the case study presented in the box provides many useful examples. Yeah, this is all solid. So I'm going to use this. This would be a great thing to bring human factors engineering under. Oops. Okay. Go ahead and paste that there. Nice. I think that's it. It's been an hour, so I think I'm gonna stop streaming. This is actually quite a bit. I can finish this all on tomorrow's stream. Cool. Alright guys, if you guys tuned in or watched later, which I don't think we have any like subs on this channel, so I don't even think anyone was really watching. But thank you guys for tuning in. Hopefully you enjoyed watching me painfully go through these outlines and topics. This is going to be a really tough exam, I imagine. Anyways, guys, see you tomorrow. Bye.